Good morning. Thank you for joining us today. I am Melissa Sullivan, the upper school principal at the Edge campus, and we're excited to have Prevention Solutions here with us. Of course, this is a Friday of a long weekend, or a long week, so we hope that everyone has a safe and happy Thanksgiving. We have been partnering with Prevention Solutions for the last 6 years as part of our comprehensive strategic plan around social health and well-being. This really is work at a capacity to support our students and really make them aware and acquire the knowledge to make good decisions. So without further ado, it's my pleasure to introduce Vicki Sandberg with Prevention Solutions. Thank you, Vicki.
Thank you, Melissa. My name is Vicki Sandberg. I'm a prevention specialist with Prevention Solutions. We, along with my colleagues Christina Bauscher and George Brown, have had the pleasure of meeting with your students this past week. We are under the umbrella of the Hazelden Betty Ford Foundation and have been in operations for over 45 years doing school-based prevention work. We have had the opportunity to speak with millions of students around the world, helping them with making good health-based decisions around the issues of alcohol, tobacco, and other drugs. And as we do that work, we have also been able to survey students and gather data to support our scientific evidence-based research and data that we are able to support students in helping keep healthy students healthy. That is what we try to do, because we know that most students are making healthy choices, and we want to continue to support that in any way that we can by giving them accurate information to continue those practices. Like I said, we've had a week-long interaction with the students at the upper school, and this has really supported the climate of prevention that Gulliver has been able to sustain within your community. Last month, my colleague George Brown and I were at the middle school, and we had touch points with the 6th graders and 8th graders, and we had a more in-depth experience with the 7th graders. This past week at the upper school, we had touch points with the 9th graders, the 11th graders, and the 12th graders through assemblies, and then we had a more in-depth interaction in the classrooms with the 10th graders. And so through having these ongoing classroom discussions, as well as the great work that your faculty and administration are doing in bringing prevention-related topics and experiences into the classroom on an ongoing basis, you all are creating a climate. This is just not an event that you bring Prevention Solutions into the classroom and check off a box. You are creating a climate of prevention that really allows your students to be healthy, and that is becoming evident in a lot of different ways that we can see at Gulliver. Your students, for the most part, are very, very healthy, and they are supporting each other in those initiatives. So our approach to prevention is really to empower the students, to give them accurate health-based information. We come at everything from a science-based approach. We don't look at anything as good or bad, right or wrong. We provide information that's all backed in science. There is no judgment about the information that we are providing students. First of all, we want to definitely identify and strengthen all of the protective factors that they have in their lives. Parents are definitely a big protective factor. Their students and their school communities are protective factors, their extracurricular activities and their peers are protective factors. Everything that protects and contributes to their well-being are protective factors. We want to help them identify and address the risk factors. What are those risk factors? How can they be aware of them, and how can we address them so that they don't interfere with their well-being? And then finally, we want to identify and intervene on any types of behaviors that could lead to the disease of addiction. As you can see here in our prevention wheel, it takes a village. It takes all kinds of things to work together on the students' behalf to keep them healthy. And we do a lot of things in our prevention planning that include the students, the faculty, the administration, the parents, the community, everybody together, all with the same goal of keeping students healthy. All the voices matter in this initiative, and we take into account everybody together moving in the same direction to keep our students educated and informed and definitely empowered. So we talk about in the classroom why teens choose to use. And we know through our work with students throughout the world that students choose to use for 7 universal different reasons. And it's interesting because it doesn't matter if we're in Miami or if we're in my home state of Minnesota or if we're overseas in Thailand or in Europe. We predominantly will find that students tell us that they use for these different reasons. Out of curiosity, for stress, to have fun because everybody does it. All the cool kids are doing it, because of a lack of information, or because of unknown expectations. And so because of these reasons, we know that we can solve for these. If we have conversations around how do we alleviate these, how can we solve for these in healthy ways, what are ways that we can have students find healthy coping mechanisms to alleviate these situations, then we can win with them, where they can have healthy coping mechanisms that will take substances out of the equation. Our intensive student education is what we've been having with the 10th graders this week, and this allows us to have more in-depth dialogue with them about the issues that they're interested in. And these are some of the things that we've been talking with your students with this week. We talk about the risks and the protections that in a more cultural or community context. We talk about what is the cultural and community environment like in your school community here at Gulliver Prep, and then also in the Miami area in general. There's been some conversations about what is it like to live in a place where people come to vacation, where people come to party, what kind of substances are found in your community, what kind of substances are found in your general area. And predominantly, we talk about e-cigarettes and vaping, alcohol misuse, and marijuana, because these are the 3 substances that we know that teens have the most access to and that are the most acceptable in this social sphere and with this age group. We know that there are a lot other drugs out there, but 90% of the people who have addiction right now, who have alcohol misuse disorder or substance use disorder, started with one of these 3 substances, excuse me, when they were teens. And so we know through that evidence-based approach that usually students will start with one of those 3 substances and then be exposed to other things. And so we want to avoid them even starting with these substances. So education is key. We also talk about the teenage brain and delayed use. From a prevention standpoint, the brain development information is one of our hallmarks of our prevention solutions experience. We talk about how the brain is not fully developed until the age of 25, and how the brain gets dopamine, and how substances offer artificially increased levels of dopamine, and they trick the brain into thinking that it needs that higher level of dopamine. And the students are very interested in how their brain is affected by those when it is not fully formed, and how that can impact them for the rest of their lives. And so that scientific conversation about brain development seems to really hit home in a student body like Gulliver, who is very academically influenced and they are very concerned about their academics. This is a highly skilled group of students who have a lot of goals for the future, and they are very concerned about their academics. I mean, that is very obvious because we have been in their directed studies classes, and they have been very concerned about their tests, about their quizzes, about making sure their homework is up to speed. They are very diligent in their studies. The other approach that we have from a prevention standpoint, other than brain development, is the social norms approach to prevention. On that list of reasons why students say that they use is that everybody does it. We know that not everybody is doing one thing or another, but we tend to hear students say that. Everybody's going somewhere, everybody's doing something. In fact, our data shows us that the majority of students around the country are actually making healthy choices. The majority of students are actually not using substances. So we tell the students that if you are choosing to not use substances, you are in the majority. So congratulations, you are going with the crowd. You are one of the group. And so we also find that many students exaggerate what they think the rest of the students are doing in regards to substance use. Many students think that the rest of the students are using substances when in reality they aren't. And then, as I mentioned, in regards to stress, that is a reason why students think that other students might be using, or why they think that they might start using, and we can solve for that by having conversations about stress reduction. What kinds of things might you do if you're stressed out about school, about sports, about family, about friends, about the future? What kinds of healthy coping skills can you utilize now and into the future that would be healthy alternatives other than substances? Can you go to the gym? Can you take your pet for a walk? Can you go out with your friends? How about deep breathing? How about yoga, music, dancing? Extracurricular activities. We have them share their lists and talk about what works for them. And then in the case that we are concerned that there might be some high-risk behavior, we do have the opportunity, because we partner with Hazelden Betty Ford Foundation, which is the leading recovery services organization in the United States. We do have the opportunity to offer early intervention resources if necessary, and work with the administration in any organization or any school that we work with to provide additional resources where necessary. So when we talk about going over the risk factors with the students so they can identify what risk factors for addiction exist so they can make educated choices moving forward, these are the risk factors that we talk about. And the number one risk factor to identify for students that they have 100% control over is the age of first use. We know that the age of first use has direct correlation to that brain development. And so anyone who starts drinking around the age of 15 is putting themselves at risk for developing addiction down the road as an adult. And there is an inverse risk relationship to age of first use and developing addiction down the road as an adult. It's around a 60% likelihood of developing addiction down the road if you start using around the age of 15. Family history is also a risk factor. There is a genetic component to addiction. It doesn't matter what substance it is, and so what we tell the students is to find out if you have addiction that runs in your family. It doesn't necessarily mean that they too would become addicted necessarily. It's just one piece of their medical makeup. And so if your student comes home and they ask you if they have addiction that runs in their family, it could be coming from our conversations in the classroom. It's just very similar to finding out if there's other diseases in your family, like heart disease or cancer or diabetes or things like that. And so that is something that obviously you don't have any control over, but it's something that it's important for them to know, to watch out for when and if they decide to use substances. They can monitor to see how their bodies react to those substances and if they have to be careful based on their genetic makeup. Here are some other risk factors: the environment that they live in and work in and go to school in. Do they find themselves in environments where there are substances available? How are their mental health? What is their personality? Are they prone to taking risks? Are they prone to having more kind of extreme types of behaviors? Have they had trauma in their past or some childhood issues? Do they have minority stress or any kinds of stressors in their world? And is there a lack of information? And that is the thing that Prevention Solutions really seeks to solve, to provide them with the most current evidence-based research and information that we can possibly give them. So when and if they are faced with that choice to use substances, that they are doing so with the best, most accurate information that they could possibly have when they're making those choices for themselves. Protective factors. The protective factors that they have are you, the parents, the teachers, their extracurricular activities. Students have so many protective factors, and we remind them of all of that. And when we talk about, I'm going to go back to that. When we talk about the protective factors, I want to talk about how many protective factors they do have as students. And when you have them start listing them in the classroom, it's amazing. We write them on the board, and they say, wow, we do have a lot of people who are on our side. You know, coaches, clubs, cultural activities, maybe spiritual or church activities, family, extended family, friends, neighbors. There's just a whole host of people who are on their side who want them to succeed. And if you start kind of expanding those circles and identifying who those people are, we talk about who are their trusted adults and who could they talk to if they get into a situation where they have some questions. And those are all people who are protective factors in their worlds. I like this slide because when we talk about brain development and we talk about communication and how the teen brain works, this is a little bit about how the teen brain might look during development and the teen years and in high school. And then this is how it's going to look when we're at age 25 and all the synaptic pruning has been done and it's streamlined a little bit more. This was actually taken by one of my colleagues overseas. This is an actual communication data system overseas somewhere in, I believe, Thailand. And so, as I said, we come at this topic from a scientific, evidence-based practice because addiction is a disease. And as such, it can be prevented. But once a person has an addiction, there actually is no cure, and that's why the prevention conversation is so important. And what I love about Prevention Solutions as an organization that I forgot to mention at the start of our conversation is that Prevention Solutions, myself and my colleagues, we are all in long-term healthy recovery. And so what I think that does is it brings value to the conversation with the students because we are able to speak to them from a been there, done that standpoint. Yes, we can bring the scientific evidence-based information into the classroom, but when you have information available to you on your phone immediately, instant information whenever you want it, they could easily Google all the information they wanted to know if they were interested. But we bring a personal story to the table that I believe adds that value and interest for the students. And we can speak to them, like I said, from a been there, done that standpoint. And they seem to be super interested in that, and they're able to ask us questions. And so we can really add that personal conversation into the scientific information and bring it all through our story so that it hits home a little differently and adds some legitimacy to the information. And that proves to be, I think, one of the most interesting parts of our experience with the students is that they really like to hear our story, and that way we can take some of this more scientific information and weave it in. And so when we talk about the brain being kind of messed up and the teen brain being interwoven with a lot of different things happening, like those wires of the previous slide, this is what's happening. I mean, they are driven emotionally, socially, they are wired to risk take and have pleasure seeking. They're trying different things out to see what sticks. And that's what they're supposed to be doing. And so in that frame, we're trying to encourage them to do all of that, but do so in a healthy manner. So the teenage brain and substances definitely have unique sensibilities because alcohol and other substances, they mimic the dopamine release that natural substances do in the brain. And so that interferes with the forming of the connections in the teen's brain. The brain cannot decipher if it is a substance or if it's a natural occurring dopamine release. And therefore, the connections are supposed to be made and formed and developed without the increased higher levels of dopamine in the brain that substances bring. So when you introduce substances into a teen's developing brain, it can delay the brain development or it can change it altogether. So a brain in transition from a child to an adult is much more vulnerable to the effects of substances than an adult brain. So delayed use is critical to protection of that formation. And the formation is not complete until around 25. And that has everything to do with the reward pathway system in the brain, which is where the dopamine comes in. And so our message from a prevention standpoint is to delay, delay, delay. We tell the students to delay use of substances as long as you possibly can, because the longer you delay use, the more your brain is formed. So why are teens choosing to use? We love this quote by Dr. Frances Jensen, who is the author of The Teenage Brain. The chief predictor of adolescent behavior is not the perception of risk, but the anticipation of the reward despite the risk. So the gratification is at the heart of the impulsivity of a teen. Other than brain development, our other pillar of prevention work is social norms approach. We know that there are gross exaggerations of students' perceptions of use amongst their peers. These false perceptions really influence reality and future use and future behavior. It very much affects younger children, because younger children will see maybe what happens at the middle school or at the upper school. And if younger children see one older student, one upper school student maybe vaping, they're going to think all upper students vape. If they see one upper student drinking alcohol or smoking a marijuana cigarette, they're going to think all upper school students do that. Do all upper school students use marijuana or vape? No, but that's the perception. And so the risk is when that younger student gets to that level, that grade level, their anticipatory socialization is going to tell them that when I get to that level, that's what I'm going to do. And so this is definitely a research-based prevention strategy that if we can tell the students and if we can encourage them to know that they're exaggerating the use of their peers, that it is definitely a good prevention strategy. Here are some current trends in the United States from 2022, from last year. These percentages, and this data comes from Monitoring the Future. It is a University of Michigan data research group that is the largest research collection agency of student use around the country. Gulliver seniors actually participate in this survey every year. And so this is current trends in alcohol in the last 30 days. And they survey 8th graders, 10th graders, and 12th graders. So the green line is 8th graders. And they 6.1% of 8th graders said that they have used alcohol in the last 30 days. 13.4% of 10th graders said they've used alcohol in the last 30 days. And 28.1% of 12th graders said that they've used alcohol in the last 30 days. Now what you can see is there has been a steady decline in these alcohol numbers. They continue to go down. We don't have good data from 2020. You can see that there is a, right here, there's a higher number, but there wasn't any data collected that year, and that was because of the pandemic. So you can see that there has been either a decline or kind of a plateau for alcohol. And these slides, by the way, I should mention, are going to be made available to you all on the parent portal. We have given them to the administration, and they will be put on the parent portal for your viewing and for your use later on, because I know this is a lot of information to digest. In regards to social norms, this is really interesting because this is from our own internal survey that we have, and we know that 0% of 9th graders agree that it's cool to get drunk, okay? But yet 9% of students in general 9% believe that students in general think it's cool to get drunk. So a lot of people, I think that you think it's cool to get drunk, but nobody really thinks it's cool to get drunk. So it's that perception, that false perceptions. So it's really that the perceptions are much greater than the reality. And we know that students in general, no matter what grade they're in, do not think it's cool to get drunk. Because what students tell us is they don't like the idea of being out of control. They really do not like that idea of not being aware or in charge of what they're doing. And so I think it's these false perceptions that are driving the behavior. So really, if we look at seniors, only 10% of 12th graders agree that it's cool to get drunk. Yet 33% believe that students in their school think it's cool to get drunk. So there is always a disproportionate number of people, of higher numbers, think than what the reality is. So again, these are the reasons why students are choosing to use. We always come back to this and how can we solve for it? And in this particular case, that everybody does it, that's not holding up. Here's the perception versus reality. There is a huge disproportionate gap in the perception versus the reality. The perception is way higher than the reality in student alcohol use. Our false normative beliefs, again, are leading into behavior based on false information. So beware of these words: always, never, everybody, nobody. Everybody's going to the party. Here are marijuana trends in the last 12 months. And again, the green is 8th grade, the blue is 10th grade, and the red is 12th grade. And so 12th grade is 31% reported in the last 12 months. 10th grade is 20%, and 8th grade is 8%. And this is in the United States. Now, I would just say anecdotally from my conversations in the 10th grade at Gulliver Prep that these would be much lower for Gulliver students. Just my, Vicky's, opinion anecdotally just from talking to your students. I think with the protective factor of drug testing that you have in your school, and then also the conversations that we've had about what drugs are the most risky with 10th graders that all three of our prevention specialists have had with your 10th graders, it seems like they feel like marijuana is not really that present here in your community, and that seems to be the least talked about and the least prevalent amongst your student body, just from what we've been able to discern this week. Here's vaping and nicotine e-cigarettes in the last 12 months. Now this is a really interesting graph because they haven't been around that long. And so we started researching them about 2016, and they went really high, really fast, because the e-cigarette companies and Juuls, they were in charge of the narrative. And they came out and said, these are way better for you than cigarettes, and they come in grape flavors and cotton candy, and they are, they're better for you than cigarettes, they're not risky, and they marketed to our young people. And so in 2019, use was really high. And then the pandemic came, and kids were home, and they didn't use as much. And then research came out, and the narrative changed. And now we know that there are risks associated with vaping. And now the students are getting that information, and they're making healthy choices around it. And so I think this is a great case study in the fact that if you give students accurate information about health, that they will follow it. Because now vaping has decreased and has continued to decrease after the pandemic. It has not gone back up. And so we are pleasantly surprised by the numbers that have come out after the pandemic. There have been social media campaigns, anti-vaping campaigns. We have more and more research out of the negative effects of vaping. And so we think that if you give students health-based information, they will listen and make those healthy choices for themselves. Now, we get asked by parents and administrators and some students as well, what about the other drugs? We predominantly will talk about marijuana, alcohol, and nicotine. What about the other drugs? We know that the vast majority of students do not do any other drugs. But here are the stats about other drugs. In the past 12 months, grades 9 through 12, 0 to 4% use by students in all grades of other drugs. And that compares to these numbers: 39% of alcohol use, 22% e-cigarette, 15% marijuana, 13% cigarette. So by comparison, you can see that the numbers of use of other drugs is minuscule compared to the alcohol, tobacco, and marijuana. However, with the introduction of fentanyl, we have started having those conversations with our students in the classroom, because fentanyl has made its way into marijuana And so we are having conversations with students about the risks of fentanyl and about the risks of purchasing or getting drugs from sources that they are not aware of where they came from. So that's why we talk about looking for signs of an overdose. We don't get into this too in depth, but we want them to have an awareness. And we talk a little bit about Narcan and just what it is. Again, we want them to have an awareness so that at least if they have some questions, they can ask a counselor, a parent, a trusted adult, that they have some awareness. Here are the overdose deaths from fentanyl, and unfortunately they continue to rise. And we see that fentanyl is becoming extremely pervasive in a lot of different things. Pills, marijuana, cocaine. It is very versatile in the fact that it can be put in a lot of different things. And so we have introduced it into our curriculum somewhat. We talk about vaping marijuana, and the thing with marijuana is that it is not the marijuana of old. Marijuana these days, the THC concentrate is much higher. It has been genetically modified to be either a stimulant, a depressant, or a hallucinogen. And now that marijuana has been legalized in some states for over 10 years, there has been ethical scientific research that has been able to be done. And we have found that it actually has been found scientifically to reduce your IQ. So it really does interfere with your memory, your motivation, your mood, and your motor coordination, all of which are integral into a student's development and development as in academics. So we talk about that with students, and in a high-achieving school like Gulliver, that hits home with students who have goals of going beyond high school and into competitive colleges. Here's the next generation of vaping, you know, with Juul and some of the legislation. That's always like lagging behind, so they're always 1 or 2 steps ahead of us, or ahead of the legislation. The next thing that's coming up is these Zyn packs that are right here. They look like breath mints. They come in tins. It's like the old chewing tobacco, but without the spitting. They're little like packets that you can swallow, the residuals, and it's nicotine salt. And they're coming in different flavors and things like that. There hasn't been a lot of research done on those. Basically, when we're talking to your students about what is the most prevalent drug that is found in your community and what they know the most about, it's alcohol. And that is definitely in line with what we're seeing with students around the country. Alcohol is the most misused substances. And that is the thing that prevents messages in the brain. Alcohol affects the prefrontal cortex, which is the last thing to be developed in teens. And it's the first thing to be affected by alcohol when a student drinks. And so that affects their decision-making, their memory, their problem-solving, their attention, and their concentration. It definitely encourages risky activities because it affects that decision-making. Common early warning signs, academic changes, although change in grades is usually something that is very late on in the process of substance use. So changes in social groups, personality shifts, maybe some hygiene changes, personality, like I said, less motivation, irritable. Unfortunately, some of these up here are just hallmarks of being a teen as well, with some hormone shifts. Family risk factors are permissive parenting. There actually is no such thing with the brain development and the health-based science behind substances. There actually is no such way of teaching your student how to use substances responsibly at home. There is no scientific research that supports that. So I know that we've had conversations with parents in the past about how do I allow my student to maybe use substances at home so that they are aware of their effects, and how can I help them drink responsibly or use responsibly. There is no scientific research that supports that whatsoever due to that brain chemistry and the brain development evidence. So lack of inconsistent discipline, lack of supervision. We know that protective factors include consistent discipline, family support, clear expectations. If students have clear expectations and no consequences of behavior, that is a very big protective factor in this arena. Providing structures and limits, rules, monitoring, and predictability, huge protective factors. Here's some different parenting styles, and we are not here by any means to tell you how to parent. That is not our role at all, but here are different kinds of parenting styles. And in this research, most studies show that an authoritative parenting style characterized by high warmth and responsiveness between the parent and the child serves protective factors very well in substance misuse or substance use prevention. So authoritative parenting style characterized by high warmth and responsiveness. What you can do: frequent, brief, high health-based conversations. Frequent, brief, health-based conversations. I found that with my kids, I always got them when we were in the car, on the way to sporting events, on the way to school. We like to say, rather than have one 60-minute conversation, have 61-minute conversations. And model healthy attitudes and behaviors. Make it normal to talk about these kinds of things. You know, whenever something comes up on TV or an ad or an activity or a current event, talk about it. Check in with your student frequently. And even if you think they're not listening or paying attention, they are. I found that in classrooms many times when I thought that students weren't paying attention or listening, or they were totally checked out. And then in the surveys at the end of the week, or towards, they'd come up to me in the cafeteria and said, "Oh, Miss Vicki, when you said this, I thought about this," and I thought for sure they were checked out doing something else. So, monitor their medications, have regular conversations, just communicate with your school, their friends' families. Be friends with their friends' families. That's a big protective factor as well. And keep the conversations going. Try to be as non-judgmental as possible. Listen to their thoughts and experiences. Give them space. And here's some further resources. Again, we're going to give you this slide deck. And check out these websites. These are very parent-friendly. There are a ton of resources that are provided on these different sources. And you can look at them at your leisure and take what you want. But there's a lot of different tips and tricks on these different resource pages. So thank you for those of you who logged in to our presentation. And thank you for those of you that attended here in person. It has just been a pleasure getting to know your students this week and the opportunity to continue the partnership with Gulliver. And I will entertain any questions that we have in person here after we are done with the live feed. But thank you so much for your participation.